Assalamualaikum warahmatullahi wabarakatuh. I beat to doctor and fellow friends. I'm Wanur Shahida and I will start the presentation of my group. Basically, for our project, we choose a topic the study of knowledge, attitude and practice toward COVID-19 among undergraduate students of IIUM in all campuses which are Kuantan, Gombak and Pagoh. On this presentation, we will present about the introduction, method, result and discussion, and the last one, conclusion together with the limitation. So, let's proceed with the introduction. Recently, the world has been shaken by a pandemic caused by new coronavirus, SARS-CoV-2 or COVID-19, which is death-threatening and highly contagious. On 18 March 2020, Malaysia began the implementation of a Movement Control Order or MCO to control the spreading of COVID-19 in the country. COVID-19 and the following MCO made by the government have profoundly affected tertiary education sector in Malaysia. Due to the coronavirus outbreak, teaching and learning activity are conducted online for all IIUM students, which has a great impact on their studies and life. Hence, many of the students are struggling with online learning due to the lack of internet access, unconducive learning environment, and other technical issues. University authorities have also been receiving requests and queries from the students on whether they can go back to the campus for face-to-face learning sessions. In order to conduct a face-to-face learning session in class for IIUM students, higher authorities and IIUM educators need to be informed on how well prepared the student in terms of their knowledge, attitude, and practices regarding COVID-19. Thus, we conducted the survey to get a result. From this study, higher authorities and educators of IIUM will get a chance to know students' readiness to attend face-to-face learning.
Okay, now I will proceed to the method for the research to be conducted. Okay, first, this study was carried out using quantitative research, and quantitative research is deal with the data collection and something that can convert it into numbers. Next, this study also a cross-sectional study which involved looking at data from a population at one specific of time. Data collection were in form of online survey and we used Google Form for the survey which contain questionnaire measuring student knowledge, attitude and practices toward COVID-19. The Google Form was distributed to the participant which was student in Gombak campus, Kuantan campus and Pagoh campus through WhatsApp, Instagram and Facebook. Mostly, we spread this survey through personally contact the student in those campuses. And moreover, for the questionnaire, we use close-ended questions such as yes or no question and multiple choice question in this survey. And the result were evaluated using statistical analysis, which 1 point will be assigned for correct answer and 0 point for incorrect answer. The questionnaire consists of 20 questions on COVID-19, whereby 7 questions on knowledge, 4 questions on attitude and 9 questions on practice, along with the several demographic questions. For the population and sample, our targeted population was undergraduate student of IIUM. The sampling method applied for this research was stratified random sampling, which involved the division of the population depending on the course offered from those campuses. A total of 200 respondents were selected as a sample size. Based on our survey, the total of respondents that we get from the survey were 246 students from all the 3 campuses, and 200 respondents were randomly selected by using Google Excel because of the limitation in knowing the actual total population of students from Gombak campus, Kuantan campus and also Pagoh campus. So we collect our sample based on total number of participants. We calculate the sample using this formula, and from the formula, we get 99 respondents from Gombak campus, 79 respondents from Kuantan campus, and 22 respondents from Pagoh campus. So the next slide is the example of our calculation to get the sample from those campuses, which is from Gombak campus, Kuantan campus, and also from Pagoh campus. And the total respondent, 200 respondents.
So, without further ado, let's proceed to the survey results. In this study, there are a total of 200 participants. The number and percentage of respondents from Gombak campus, Kuantan campus, and Pagoh campus were 99 respondents, 79 respondents, and 22 respondents respectively. The results of the demographic characteristics of the respondents shows that the age of respondents were between 19 to 35 years old, and majority of respondents were in the age of 20, which are 133 respondents. 50 respondents were male with a percentage of 25%, and 150 respondents were female with a percentage of 75% participating in this survey. In order to measure the knowledge on the COVID-19 virus among the respondents, a total of 7 questions were used as stated in the slide. The percentage of respondents who answered all of the knowledge questions correctly was 24%. The results are obtained by dividing the total number of respondents who answered all of the knowledge questions correctly over the total number of respondents multiplied by 100. Next, the results also indicate that the percentage of knowledge on COVID-19 of participants from IIUM Kuantan campus was the highest, with a percentage of 27.85% compared to Gombak campus, 4.58%, and Pago campus 22.73%. The results are obtained by dividing the total number of respondents of particular campus who answered all of knowledge questions correctly with total number of respondents from that particular campus multiplied by 100. The difference in the percentage of knowledge on COVID-19 might be related to their field of study, in which majority of the Kuantan campus students are studying in the medical field, while the students from Gombak and Pago campus are studying in non-medical fields. Based on the results, the students showed good knowledge regarding the transmission of the COVID-19 and the classification of the COVID-19, where more than 90% of students knew about it. They knew that the virus primarily transmitted between people through respiratory droplets that comes from the mouth and nose during sneezing or even talking. Most of them knew that COVID-19 is not transmitted through semen and vaginal fluids or anal mucus, by eating contaminated food, or through drinking. As we can see in the second question of the knowledge assessment, about 98.5% of the students were aware that COVID-19 is a type of virus infection, while only 1.5% of them considered COVID-19 is a type of bacterial infection. Next, for the third question, it can be observed from results that 67.5% of the students were aware of the symptoms of COVID-19, such as fever, dry cough, chest pain, and difficulty in breathing. Meanwhile, the rest of the respondents chose only one of the symptoms of the COVID-19 infection. That's all from me. I pass the presentation to Sister Anis to further discuss the survey results.
Now we move on to the first question. There was a noticeable confusion among the respondents whether eating or touching what animal would result in infection of COVID-19. It can be seen that there are more than half of the respondents did not manage to answer correctly. Next, in the fifth question, they will ask whether they can always tell if someone has COVID-19 or not. About 178 of the respondents knew that some of the infected individuals may not develop any symptoms of COVID-19. Among the total of 178 respondents, 76 out of 79 students from Kuantan campus managed to answer correctly. This might be related to their field of studies in which majority of the Kuantan campus students are studying in the medical field, while the students from Gombak and Pago campus are studying in non-medical fields. Thus, maybe some of the students from Gombak and Pago campus were not familiar with asymptomatic. Next slide. Besides, most of the students, which is about 94% of them, also believe that people who have health conditions like lung or heart disease, diabetes, or conditions that affect the immune system, and older people, especially those who age 70 and above, are at high risk of getting COVID-19. For the last questions on knowledge assessment, a major portion of the students, which is about 97%, knew that the incubation period of the coronavirus can be as long as 14 days. Among them, all 79 students from Kuantan campus managed to answer correctly. Overall, the students showed a good knowledge towards COVID-19 as they could obtain the information from the news, the internet, as well as social media, including Instagram, Facebook, and Twitter.
Okay, now I will continue with the assessment on the attitude. We intend to know the perception of respondents towards the current situation of COVID-19. Thus, the first question is whether they are confident or not the government can win the battle against COVID-19 crisis. The results showed that majority of the students from Gombak, Kuantan, and Pago campus are confident, and this showed that they have expectation towards the government that they can handle the pandemic situation well. Okay, the next question is to see whether the students agree the SOP implemented by the government can reduce the impact of pandemic.
we got a positive results where 164 respondents over 200 agree and support the statements where the SOP are effective to the current situation. According to the result, it indicates that the students are well aware and practicing positive attitude towards the government and other people as well, which really helping in combating COVID-19 crisis. Lastly, we also include a question about opinion of respondent if they are agreed to proceed with virtual learning if the COVID-19 outbreak get worse. Overall, majority, which is 88% of respondents agree to do virtual learning, while 12% did not agree and want to go back to the campus to do face-to-face learning. This may happen due to some circumstance, like the unconducive learning environment, poor internet connection, or the responsibility that they have at their home hold them from focusing to their learning process. Therefore, generally, majority of the respondents from all campus, Gombak, Kuantan, and Pagoh, have positive perception and good attitude during this outbreak.
So, for my part, I will present the assessment on practice. We provide 9 items in the survey to assess the level of practice among the IIM students. So, here is the result. Those questions on the screen are the questions that get high majority correct answer, which are more than 90% of the students show the correct practice. For example, 98.5% practice social distancing, 92% practice hand hygiene, 97% practice the correct way to wear mask which cover nose, mouth and chin. Lastly, 98% self-quarantine at home when feeling ill. However, there are also several questions that indicates poor practice of COVID-19 among the IIUM students. For example, 46.5%, which are almost half of them, done a prohibited thing during COVID-19, likes do handshaking, hand out at mall, and do unnecessary visit. Moreover, there are only 53% of IIUM students that wash their hand after coughing or sneezing, and only 53% of them put their mask in a clean paper bag when they go eat outside. So from the result, Kuantan campus has the highest level of practices, followed by Gombak and Pagoh campus. This happened might because IIUM Kuantan campus mostly has health science-based students like pharmacy, biomedic, kuliah medicine, dentist, and so on. And lastly, for overall result, IIUM student shows high level of practices because most of them follow the important SOP like social distancing, wear face mask properly, self-isolating when ill, washing hand, and which those elements are very important in order to prevent the infection from spreading. So this might because IIUM student has practiced the correct campaign.
So next, I will proceed to the last part, which is the conclusion and limitation. Next slide. So for limitation, there are 4 limitations overall. The first one is limitation on the respondents, whereas most of the respondents are 20 years old. This is because this survey is distributed through many social media platforms, and WhatsApp is the dominant. Hence, the respondent for this survey is mainly from our age, which is 20 years old. Second, respondent from Pagoh campus is insufficient because we did not have enough contact numbers in order to help us in distributing this questionnaire to the Pagoh student. The third one is did not know the exact number of total students in IIUM from all campuses because it will affect our calculation, especially in calculating the sample needed. Last but not least, incomplete answers from the respondents. Unfortunately, we also have some respondents that did not manage to answer all the questionnaire, so it will spoil the survey. Next, for the conclusion. Next slide. In conclusion, the highest percentage of knowledge level was Kuantan campus, and the attitude was Pagoh campus, and the practice was Kuantan campus. The present study was able to provide a comprehensive examination of the knowledge, attitudes, and practice of the IIUM student in all campuses towards COVID-19. These results also indicate that the student of all IIM students have an appropriate depth of awareness of COVID-19. Moreover, this study was able to increase the level of awareness regarding the COVID-19 among IIM students. So the findings show that the students have a good attitude to deal with the SOP that have been set by the government. So I guess that's all from us. Thank you very much.